Good evening. We have with us Dr. Subhradeep Ghosh, intensivist and director of critical care for this hospital, Faridabad. Doctor, we welcome you to the Natco Pharma Specialty Studio this evening, and we look forward to your advice to the young generation of doctors in the space of critical care associated with bacterial resistance. What, as per you, are the changes you have foreseen in critical care management?
So, good evening, everyone, and I would like to thank Netco for giving me the opportunity to be here and share my thoughts both on critical care and especially in rising bacterial resistance and how can we prevent that aspect of critical care. Of course, this is not everything about critical care; it is just a part of the critical care spectrum. Critical care is an all-encompassing specialty. So this is a unique specialty where you take care of the patient from the very beginning when the patient is in dire need of immediate help in terms of resuscitation, to making the diagnosis, to making initial assessment of the patient, to sending the investigations, talking to the relatives when they are in the maximum distress, taking care of the patient throughout the course of the intensive care, which not only involve the resuscitation, not only involve the diagnosis, also involves the caring them when they are in different organ dysfunction, taking care of their ventilator needs, taking care of the ECMO needs, taking care of the dialysis requirement, care of the blood pressure, oxygen requirement, to every day taking care of their relatives, because they are the one who are going through the maximum uh, traumatic experience. So taking care of them. Then in some patients they do not recover. Identifying those patients, again talking to the relatives, talking to different other specialties who are involved in critical care, and making an opinion regarding the uh, futility of the care, discussing the same with the management, discussing the same with the family. So you see, to the even some of the patients that do not survive, to taking care of the grave reaction of the patients. So it's a all encompassing specialty, but unfortunately infection is one of the very important aspect of taking care of these patients. Many of our patients, they get admitted to the intensive care unit with infection. They usually do not have much resistance problems because they mostly they come from the community. Some of them, of course, they come from other hospitals carrying some infections which may be resistant. Some of them, they develop infection in the intensive care unit itself, or maybe in the hospital. So we do get patients from the wards who were there in the wards or in the floor for some period of time, and they develop an infection. They come back to us. So they may be carrying some infections which may be resistant to the things. So my suggestion to my younger colleagues is, of course, be very proud of being an intensivist. We are at the pinnacle of every specialties. We are the one who are jack of all trades and master of ventilation and hemodynamics and diagnostics and resuscitations. And apart from that, we are the one who are there at the bedside of the patient when they are at the maximum need of a doctor or a medical facility. So we be very proud of being an intensivist. You may be earning a lot, earning much lesser in comparison with many other specialties, but you are there. Your morality and your integrity and everything can actually help the patient, and you being the real hero. Regarding the infection prevention and how can we take care of the resistance, yes, of course, the most important aspect is taking care of the antibiotic stewardship program, and starting from recognizing the fact that when you should not give antibiotics. So far, our aim was to when to give antibiotics as early as possible. But now our aim is when not to give antibiotics, and when can we not give antibiotic without causing harm to our patients. So this is the first thing. Second thing is, even if we give antibiotics, give the antibiotics in an appropriate manner, meaning thereby when you choose an antibiotic, first thing is, where is the source? So unless you know the source, or if you do not have a reasonable understanding of the source, you can't prescribe an appropriate antibiotics. So identify the source. Once you identify the source, you need to know what are the possible organisms which are causing these infections. Once you know the possible organisms which are causing the infection, what are the possibility of resistance in such patients? If the patient is coming from a community acquired, very less risk that patient will have resistance, unless of course this patient has got a urinary infection where the ESBL prevalence is more than 40% or 50%. Once you know that, then go for what are the options we have which can take care of these organisms. Once you have these options, then you need to see what are the end organ involvement, whether this patient can be given this particular antibiotic with the presence of renal failure or hepatic failure. What are the penetration of this antibiotic to that particular tissue where you are actually targeting, whether it is CSF, if there is a meninges, the penetration is less. And of course, the toxicity of the particular antibiotic, the cost of the particular antibiotics, everything needs to be taken care of. So once you have chosen the antibiotic, then you need to go for appropriate delivery of the antibiotic, taking care of the pharmacokinetics and pharmacodynamic parameters. And once you do all these things and you have the culture available, you need to de-escalate. You need to reduce the burden of the things. And finally, reduce the antibiotic duration as much as possible. In most infection, you do not need to give antibiotic for more to 5 to 7 days, but there is no point continuing it for 14 days, 15 days, 20 days, 21 days, unless it is a deep-seated infection, unless you don't have the proper source control available. So this is my way of doing the things, and I believe it will help the patients in taking patients and your medical fraternity. And of course, it will also take care of our old age. One fine day we will be old and we will be requiring antibiotics, all of us. And if you do not have an effective antibiotics, nothing is possible. And I strongly believe, as a human being, we need to pass on 4 things to our next generation: clean air, clean fuel, clean energy, and effective antibiotics.
So, Dr. Ghosh, you have in fact answered all the three questions even before I could ask them to you. And what I like is you talking about the human touch. That is what you brought out very strongly. So, I thank you so much for your time in giving a very, very detailed explanation about your practice, the advice to the young doctors. And we wish you all the best, Dr. Ghosh, in your practice. Thank you so much for spending time in the studio.